Hello, everyone, and thank you for joining us this afternoon. I'm Rosemary Martinez. I'm Senior Director of the Board on Population Health and Public Health Practice. I also direct the Roundtable on Health Literacy here at the National Academies of Sciences, Engineering, and Medicine. We welcome you to today's workshop, Engaging Community Health Workers, Youth Ambassadors to Improve Health Literacy. We are fortunate to be joined today by ASL interpreters who will be ensuring that our deaf and hard of hearing audience can participate in our workshop. We organized this event in collaboration with the Department of Health and Human Services, Office of Minority Health. We would like to thank them for their partnership on this effort. As you know, April is National Minority Health Month. It serves as a reminder of the need to address health disparities and advance health equity for all. Our collaboration underscores our shared commitment to improving health literacy. This workshop focuses on exploring the use of community health workers and youth ambassadors in promoting health literacy in the community. The sessions will highlight select grantees supported by the Office of Minority Health grant programs and will highlight accomplishments and implementation issues. This webinar is hosted by the Roundtable on Health Literacy. For those who may not be familiar with the Roundtable, it is a convening body of health literacy experts from academia, healthcare, pharma, community-based organizations, and other fields. The Roundtable holds public meetings such as this one to share promising and best practices and cutting-edge research around specific topics in health literacy. I'd like to take a moment to thank our staff at the National Academies, Kelly, Neha, and Christy, for their assistance in organizing this workshop. Our agenda for today's session begins with representatives from the Office of Minority Health who will provide background on their grant initiatives. After that, we will have a series of 4 presentations from grantees who will provide overviews and highlights of their programs. Then we will have an open discussion with our presenters. Our moderators have some questions for our panelists, but we will do our best to incorporate yours as well. So to our audience, please submit questions through the Q&A function at the bottom of your Zoom screen. Finally, please note that there are additional resources on the Roundtable website, which is nationalacademies.org/health literacy RT, our panelists' bios, and a white paper by the Office of Minority Health titled Engaging Youth and Young Adults in Community-Based Strategies to Improve Health Literacy are posted there. A recording of this workshop will be uploaded to the website a week from now. Now it's my pleasure to introduce our collaborators, Alana Sutherland and Rashmita Subedi. Alana and Rashmita both serve as public health analysts and project officers for the U.S. Department of Health and Human Services Office of Minority Health, as well as on the planning committee for this workshop. Alana and Rashmita provide technical assistance to federal grant awardees for initiatives that focus in part on advancing health literacy improvement strategies within racial and ethnic minority communities. And with that, I will turn it over to Alana.
Hi, thank you so much. I'm going to share my screen. And I just want to say again, thank you to the National Academies for having us here today and for their collaboration in putting together this exciting program. The Office of Minority Health aims to improve the health of racial and ethnic minority populations through the development of policies and programs to eliminate health disparities. One of the primary functions of OMH is to support effective approaches for improving health outcomes through demonstration grants by engaging states, territories, tribes, community members, and healthcare providers OMH works to develop mechanisms for information dissemination, education, prevention, and service delivery to individuals from socially vulnerable, backgrounds, including racial and ethnic minority groups. During public health emergencies, racial and ethnic minority populations bear a disproportionate burden. Among the many risk factors for higher rates of illness and death are challenges around effective communication and understanding of often complex health information. Even early in the COVID-19 pandemic, evidence showed that lower access to relevant and accurate information among racial and ethnic minority populations affects decision-making and health behavior. It was and still is clear that improving health literacy can contribute to better responses to public health strategies for COVID-19 and related health outcomes. And that's why today we're joined by representatives from organizations funded by 2 OMH initiatives that, among other things, have sought to increase public awareness around COVID-19 prevention and service delivery in racial and ethnic minority, rural, and socially vulnerable communities. The National Infrastructure for Mitigating the Impact of COVID-19 within Racial and Ethnic Minority Communities initiative is a 3-year cooperative agreement between OMH and the Morehouse School of Medicine. Key strategies include developing and disseminating culturally and linguistically diverse information through a national network of partners, the National COVID-19 Resiliency Network. The Advancing Health Literacy to Enhance Equitable Community Responses to COVID-19 initiative supports city and local governments in increasing the availability and access to culturally and linguistically appropriate health information and improve responses to public health strategies that reduce COVID-19 risk among racial and ethnic minority populations. So thank you. That is my brief overview, and I will hand it now to my colleague to introduce the speakers.
Thank you, Alana. So with that, it is my pleasure to introduce our speakers. Each speakers will take 12 to 15 minutes to introduce themselves, their work, and how it relates to these topics. First, we'll hear from Dr. Arlita Lizana from Morehouse School of Medicine, who will talk about the university's training curriculum for community health workers. Second, we have Anthony J. Mingo Sr. speaking about designing and implementing the Youth Ambassador Program at Fairfax County Health Department. He is joined by 3 youth ambassadors, Nea Bonilla, Yalda Jimenez, and Salam Demek. Third, we have Dr. Charlene Newman to discuss the Advancing Health Literacy in the Alabama Black Belt Grant in the town of Fort Deposit. She is joining today with Youth Council member Zamarian Wilson. We will conclude with Dr. Jason Rosenfeld and Leonard Trevino, who will discuss building up the community health worker workforce in San Antonio, Texas. We will then jump to the panel discussion following this order: Morehouse School of Medicine, Fairfax County Health Department, Town of Fort Deposit, and San Antonio Metropolitan Health District. Please note that the full bios of each of these presenters are posted on the event page. With that, I'm delighted to hand it off to our first speaker, Dr. Arlita Lizana.
Hello, everyone. Good afternoon. I'm so honored to be here to speak with you this afternoon. So today I'll be talking about the youth and young adult community health worker initiatives we have at Morehouse School of Medicine. So next slide, please. The pilot for the Young Adult Mental Health Workers Training Program is a part of the OMH INSERN National COVID-19 Resiliency Network project. Next slide. So I am an associate professor in the Department of Family Medicine and associate vice president for health innovation and strategy at Morehouse School of Medicine, and also principal investigator for the Innovation Learning Laboratory for Population Health. The Innovation Learning Laboratory is really responsible for doing demonstration projects that include translational studies that generate innovative technology-driven healthcare models. All of our projects have three things in common. It has community engagement. They have an issue or problem that the community would like to solve, and they include technology. Next slide. So next slide, please. So I'll talk a little bit about the community health worker landscape at Morehouse School of Medicine. So Morehouse School of Medicine has trained community health workers, promotores, lay navigators for more than 25 years. To date, Morehouse School of Medicine has trained more than 1,500 community health workers to work in a variety of settings. We have two major American Rescue Plan grants. So the HRSA Community-Based Workforce to Build COVID-19 Vaccine Confidence Grant with our program HealthWorks, and a HRSA Community Health Workers Training Program grant, which we're working on a CHW apprenticeship program. So today I'll talk more about the Office of Minority Health and the National COVID-19 Resiliency Network. So next slide, please. So in the MSM community health worker landscape, some of the things that we're working on is the development of a community health worker institute. So that institute would cover workforce development, our rapid training and deployment model, and a hybrid CHW registered apprenticeship model program. We work on curriculum development and adaptations. We train employers to effectively incorporate CHWs into business operations. We assist organizations with data for CHW engagement and also data training for community health workers. Next slide. So just a little bit of background about the MSM Youth and Young Adult Community Health Worker Initiatives. We started with a patient-centered medical home and neighborhood in 2015 that was sponsored by United Health Foundation. And so one thing that we found out, although we had really great outcomes with our most high-risk patients, we discovered that we did not have enough community health workers to participate in the program. So we had the idea in 2016 to train youth as a part of our patient-centered medical home and neighborhood. So we began working with the Atlanta Regional Collaborative on Health Improvement. So our first cohort of our high school and young adult community health worker training program began in 2016. It had an emphasis on youth health literacy. So some things that we know are that adults who experience health disparities in their youth are more likely to have increased morbidity and mortality. And youth with poor health literacy and health behavior efficacy are more likely to continue negative health behaviors in adulthood. So the approach that we took was to include structural community youth-led interventions, the idea of the use of social ecological theory, using community participatory based research and academic community partnerships, and optimal adolescent health. So next slide, please. So our youth and young adult initiatives with the high school and young adult community health worker program in 2016. So we're currently, we'll begin the 9th cohort coming up soon. And what we did from that basis of that curriculum was to develop the subject matter adaptation. So we have an opioid reduction translation, a mental health worker translation, which I'll talk about today, and 3 cultural adaptations, also training of trainer workshops, and 2 other initiatives that I'll also speak about. So today I'll just highlight the high school and young adult community health worker program and curriculum, and the young adult mental health workers training program and curriculum. So next slide, please. So the high school and young adult community health worker training program is a year-long program that really seeks to engage family, peers, and communities in strategies for better health and wellness. So the program objectives are really to increase the number of trained community health workers to assist with community health programs in underserved communities. We really want to provide a health careers pipeline program and mentorship for underserved students. We want to support and promote the community health worker field, promote health education and health literacy in schools and community, and assist trained high school community health workers with design and implementation of school-based and community-based health initiatives. In addition, the students provide health monitoring and health literacy activities to their families and community members. Next slide, please. So at this point, through the Morehouse School of Medicine program, we've trained 196 students. So most of these students are from the Southwest Atlanta area, but there are also some that are across the nation as we went to a virtual program in 2018. Actually, in addition to having a program at Morehouse School of Medicine, with the curriculum sales, we've trained an additional 276 students nationally. So we have purchases from around the country. The curriculum itself consists of 20 modules, and it really covers all of the core competencies of community health work. So as I mentioned, we have the curriculum development began in 2017. We did the pilot testing, the curriculum sales, began in 2020. And since then, we are working on 3 adaptation models. Next slide, please. These are some of our partners that worked with us on the high school and young adult community health worker training program and purchasers of the curriculum. Next slide. So one thing that we began to notice as we were working with the high school and young adult community health workers is that the students themselves were dealing with a lot of social determinants. So some of the students that we were working with were dealing with homelessness. They were dealing with family issues and problems. And so one thing that we thought is that we really needed to emphasize the mental health piece of our curriculum. And so we know that there are a lot of heartbreaking youth mental health stats. A lot of them have been in the news lately. And we also, know that mental health services, there are access challenges in underserved communities. So what we wanted to do was move toward a solution, really figuring out how to have the right message with the right messenger at the right time. So we wanted to be able to engage residents, businesses, institutions, and trusted community leaders and really empower young adults to lead. So next slide. So through the National COVID-19 Resiliency Network, we were able to begin piloting the Young Adult Mental Health Workers Training Program. This program is a 6-month virtual program designed to align 3 focal components to address mental health and well-being among youth. So mental health literacy training, community-based mental health interventions, and a year-round engagement through mental health screening and reinforcing lessons. So at this point, through the Young Adult Mental Health Workers Training Program, we are on cohort 2 of that pilot. In addition, we have 2 other pilots going on. We have a Haitian American and young adult mental health worker, community health worker training program, and an Indigenous American mental health worker training program. So at this point, 43 have been trained and 105 in process. So the idea behind this program, the program objectives are really to increase the number of trained young adult mental health workers to assist with mental health education in underserved communities, provide mental health monitoring and mental health literacy activities to family members and community members, to increase mental health resources and improve health equity in local communities, promote mental health education and mental health literacy in school and community, and really just to introduce a new cadre of emerging adults to the field of mental health and help them take an active role in the health and mental wellness of their community. Next slide, please. So this program also wanted to mention FamStrong. So FamStrong is a mental health fund box that we distribute to families. And I wanted to mention this because we also use this with our high school and young adult community health worker training programs. So this is a fun way for the young people to participate with their family in mental health education. They have a box, and the box has a whole bunch of fun activities, and you see the comic books come with the box, and there's an app. And so it's just a fun way for the young people to show what they've learned in the program. Next slide, please. So impact, just really quickly, the high school and young adult community health workers training program, as well as the young adult mental health workers program, really has had great impacts. And just one that I would really like to talk about really quickly is we were featured in Yes Magazine. And one of our high school young adult community health workers was doing his monthly monitoring with his mother, taking her blood pressure, and realized that her blood pressure was high, and said, "Mom, did you know this?" And she said that she didn't, and he got her to go see her primary care physician and really start getting her treatment. And she credits her son with saving her life because she did not know that she was hypertensive. So this just shows an example of the impact that this program has had and can have, on community health. Next slide. So thank you very much for your time today.
Thank you, Dr. Lozano, for your insightful presentation. We'll now turn it over to our second speaker, Anthony J. Mingo, Sr. Anthony, the floor is yours.
Thank you, Rashmita. Good afternoon, everyone. I'd like to take this opportunity first and foremost to thank you for this time, the Office of Minority Health and the National Academy. Thank you for the opportunity to share our exciting work here in Fairfax County's Health Department with our Public Health Youth Ambassador Program. You should know that this program was developed as part of a broader health literacy community capacity building initiative entitled Stronger Partnership, Stronger Community, using health literacy to increase resilience. And we call it Stronger 2 effect, or Stronger Squared affectionately here in Virginia. It was fully funded by HHS Office of Minority Health. And as a component of the overall Stronger Squared initiative, the Public Health Youth and Ambassador Program trains high school students from African American, Hispanic, Latino communities as community health workers, and seeks to increase long-term the diversity among health professionals here in Fairfax County, Virginia. Additionally, as you can see in this picture, our program was recently recognized by the Office of Minority Health. And this is a picture of our graduates of our first 3 cohorts with Admiral Rachel Levine, Assistant Secretary of Health. Next slide, please. Briefly, I'd like to share our justification for needed change as we saw it in Fairfax County. Our program was designed to create change and enhance our opportunities for students of color in Fairfax County. Both Black and Brown students have fewer opportunities and more challenges than their white peers as they work to overcome overlapping burdens such as economic disparities, food and housing insecurities, language barriers. Hispanics make up over 1/4 of the public school population in Fairfax County at 28.1%, and African Americans or Blacks at 9.8%. Yet combined, they represent over 3/4, almost 80% of the economically disadvantaged students in our county. Next slide, please. Additionally, Black and Brown youth are disproportionately represented amongst those living in poverty in our county. Black students are 5 times more likely to live in poverty than their white counterparts. Hispanics almost 3 times as likely. According to our 2021 Fairfax County Youth Survey, Hispanic students were 21.4% and Blacks 17.8% more likely to spend an hour or more going to work on an average school day than their white counterparts. Thus, the need for low-income youth to help financially support their families makes it imperative that programs like this such as the Youth Ambassador Program, operate within school hours when at all possible. Next slide, please. Our program seeks to make three main impacts in our community. First, support the student participants' selected career trajectory and give them the tools to track to college or university and then on to health sciences careers of their choosing. Two, to influence and impact generational health within our communities from which they themselves reside. And three, provide a health careers pipeline and program and mentorship for underserved student populations. Next slide, please. Through a unique partnership with Fairfax County Health Department, Morehouse School of Medicine, our Fairfax County Public Schools, community and faith-based organizations, our FQHCs, and iNova Hospital System, this project permeates school, home, and community. At school, our students discuss current and historical community-focused health issues and topics, as well as complete the required 20 comprehensive online modules. Our program leverages the robust strengths of Morehouse School of Medicine's curriculum and coupled with strong practicum field experiences, additional experiential learning and mentoring opportunities through our committed partners to give our students as close to a firsthand public health experience as possible. Our program also focuses on building competencies related to health disparities, community engagement, social determinants of health, care coordination, communication, and building demonstrated leadership. At home, our students, as part of their program, they conduct, as you heard earlier, health checks with their families, such as taking blood pressure, temperature. Also, our students lead and develop a community health project that's required in our program. The project is of their choosing, but it must utilize the skills gained in the program to produce a health project idea that can positively impact health in their communities. Each of our students must, next slide, please. Each of our students must complete 70 practicum hours in the community working with our partners. Next slide, please. Our program requirements, our students are typically 10th to 12th graders, residents of our county. There is an application process. They must have a minimum of a 2.5 GPA to enter into the program, but it should be noted that most of our students, our average GPA is 2.85, but 60 plus students in our program have over a 3.65 average. Next slide, please. Our students also experience engagement with mentors, particularly with first and second year medical students at Georgetown Medical School of Medicine. Next slide, please. And then finally, ultimately, the goal of our program is to provide Black and Latino students the essential knowledge and experience and skills that they can lead to successful public health careers of their choosing, where they can help define culturally and relevant solutions and transform ultimately policy and practice. The knowledge that our students are gaining in our communities and in this program, we believe will pay forward in their communities. They've gained new skills. They will invest those skills in their future desired careers. And on the surface, I will tell you that the program is about workforce development and educational attainment, addressing the ongoing diversity gap between those receiving community health services and those providing them. For sure, this program does that, but it also helps our students to better understand and address the root causes of social injustices which have deprived them and their families opportunities to thrive. So we're changing the trajectories of lives of our students and families, and we thank you. Next slide, please. So at this time, I'd like to introduce our student presenters. You've met them earlier. It's Naila Bonilla and Yelda Jimenez and Salam Damik, and we're just super proud, and I'll hand it over to them. Next slide, please. Naila and Yelda.
Hi, I'm Yalda, and this is Nyla. We're from Justice High School. I'm a junior, Nyla is a junior, and we have both, we're both working on a project right now about low-income healthcare accessibility at our school. And why we chose this project is because many communities throughout the United States don't have the healthcare access due to money, transportation, time, and more. The focus of our advocacy is to provide accessible healthcare to those in their community who don't either have insurance or money for medical costs. Our target audience is low-income families such as Hispanics, Latinx, and Black American communities. For the meantime, we're trying to focus on having the fair here at our field and providing it to our community.
Yeah, so some partnerships we have acquired so far is with the Virginia Health Department, as well as Fairfax Health Department, the MAP Clinic, and the Penn Foundation, as well as the Health Well Foundation and Innova. So we've already volunteered with the MAP Clinic, and through the experience, we have met with Miss Mary, which is one of the coordinators of the clinic. And by volunteering, we were able to have better understanding of how to help the community. And we've also been in contact with the health department, specifically with Miss Marianne. And through that, we've been able to plan out our health fair for our school community.
Thank you, Yelda. Go ahead. Salim.
Hi. My name is Salam Demeka, and I'm also a junior at Justice High School. I am originally from Ethiopia and came here as a young child, and it's a big part of my identity and influences me every day as I strive to be an ambassador of change, which is something I've also taken from this program. Through this program, I've been able to develop a project that I've been working on for the past couple of months that focuses on road safety in Fairfax County and in Virginia, as well as we've been seeing a rise in teenage car-related accidents over the past few years. And I think this is really important as it has impacted my community, but also more specifically my school as well. And this came from a place where a friend of mine who I'd seen in classes all the time and was familiar with had passed away last year as a result of speeding and driving. And the lack of the necessary resources to prevent this is what inspired me to embark on this journey. That was my project. The goal is to propose the addition of a pedestrian activated signal at that specific intersection on Columbia Pike and Tyler Street. And I'd like to partner with the Fairfax County Department of Transportation, as well as the Fairfax County, the Virginia Department of Transportation as well. And in order to build safer streets in my community, to ensure that this isn't a problem that students have to worry about as they walk to school, as they drop off their brothers or sisters to school. And so that is what I'm working on currently. Thank you all.
Thank you, Salam. In closing, as we close, we just thank you for the opportunity to present. As you can see, these are wonderfully talented and that have students that have bright futures, and we're just excited about the impacts that they are going to make in our community of Fairfax County. Thank you, Rashmita. Off to you.
Thank you so much, Mingo, Nea, Yalda, and Salam for sharing your work with us. It's truly inspiring to see how it has inspired you to become a youth ambassador. Thank you so much. Now I'm pleased to introduce our next speaker, Dr. Charlene Newman. Dr. Newman, take it away. Thank you.
Hello. So I also want to introduce my co-presenter, our Youth Council member, Jamarian Wilson. So we are presenting our project, Advancing Health Literacy in the Alabama Black Belt. So our next slide, please. So this is a collaborative between 5 communities in the Alabama Black Belt, with Fort Deposit, the town of Fort Deposit as the lead. On the slide, you can see some information about the demographics of these 5 communities, but who the community is really, they're a great group of residents. They are proud, and they are very capable, but they have been dealt, I think, a bad hand, right? And so there's, of course, poverty in the space, but that poverty, in my opinion, is not necessarily any fault of their own. It's due to a lot of historic oppression in the region. Next slide, please. So we developed this project it's a community-led project. I will sort of say that. So it's really a ground up. So unlike the previous 2 presenters, what we've been doing with this project is really listening to the community and trying to understand what the community's needs are, what problems they're facing, and then trying to provide information and education that meet those needs. We did focus on using youth to help deliver some of that information and to do a lot of training in that space. But one of the first things throughout the whole project, what we've been doing is, again, listening to the community. And so we've had a number of community events that have been that the Youth Council helped to organize. And a theme that kept coming up in all of our events is a healthy mistrust of healthcare, right? So, and this is not an unfounded mistrust, right? Because we know what the history is. Again, we are in the Alabama Black Belt, and so there's definitely a good reason to have a healthy mistrust of healthcare. We also have done a number of surveys, and the clinician-patient communication survey really, I think, was an eye-opener and explained a lot of that mistrust that's still here today, because the residents report that clinicians don't ask them many questions. They don't ask them their opinion. They don't listen to them. And so how do you become healthier if you don't have a healthy relationship with your clinician and you don't trust them to provide good care, and you're too afraid to ask them too many questions, right? And so one of the things we wanted to do was train our youth to be advocates, health advocates for not just themselves, but also their families. And also getting the community to make use of their youth if they're uncomfortable asking those questions, because our young people don't tend to be as afraid to ask a question, right? And so we also have done a lot of work trying to help them prepare to go to a doctor's visit. But I think the real responsibility in terms of mending the trust issue, this trust gap, is really on the side of the healthcare profession. And so we also, as a part of this grant, did some evaluations in terms of organizational health literacy. And organizational health literacy is a social determinant of health, right? So one of the things that we found is that, and we focus on our health departments in each of these counties, but also in the federally qualified health centers that would allow us in. And we found that there were issues with the signage, maybe not presenting individuals on those signs that the people in the community could relate to, not a welcoming greeting by the receptionist. And there's no use of shared decision-making or teach-back procedures being used in these organizations. And so we did some education, and we're hoping that some of that what we sort of provided would be adopted, just to make it sort of more comfortable for the community to actually seek healthcare. Next slide, please. Again, a big part of our project is the youth council. So each of the 5 communities, they have their own youth council. And our goal was really to borrow from those 80s campaign around smoking cessation, where there was a lot of educating young people about the dangers of smoking, and then they nagged their parents to stop smoking, right? So our goal was to educate our youth about being healthy, so that they nag their parents and grandparents to eat better, exercise, and sort of take better care of themselves. Again, with the goal of empowering our students to be health advocates, and to take ownership of their communities and environments, and make sure that they understood that they can make change when they needed to. I think the other thing that we found was that a lot of our youth council didn't really know what healthy meant. So some in conversations with many of them, in their minds, if their loved one wasn't in the hospital or like sick, then they were healthy, right? So it was also some time spent just sort of defining what healthy is, which we found to be incredibly important as a part of this. Next slide, and I'm going to turn it over to Jamarian to give his perspective on the programming.
Thank you, Dr. Newman. Under the program, we really focused on health advocacy. Well, us being health advocates, because like you said, our community really doesn't know how to ask questions, or they're just scared to ask those questions. We followed up by going around asking community, like, okay, if you don't know about this or this, we got to show them things from different collaborations. Like when we worked with UAB to bring free eye care to the community, we talked to some of the elderly people who weren't that proficient in reading, showing them how they can ask their doctor how they don't really understand, like, if my eye is this bad, how should I go about finding the resources for that? We found that a lot of people are basically just scared. They don't know if their doctor can be trusted or how to actually go about receiving healthcare from those doctors.
And in terms of what you learned about mental health and nutrition?
What I learned about mental health and nutrition is that for the most part, you have to be willing to work with people to kind of figure yourself out too. And with nutrition, the people from, I think that was University of Alabama that came down and talked to us, they talked to us mostly about basically finding the right foods and other things that we need to bring ourselves back to where we actually need to be.
Okay. Next slide, please. And I just wanted to give one example of one of the activities from the Youth Council in York. So we visited York and had a conversation with the Youth Council about their eating habits. And then it turned out that nutrition was really bad. The youth there don't eat many vegetables. And what they really wanted to do was a cooking class with their parents, so that they can learn about different spices and use less salt, and how they can incorporate foods that maybe they don't typically eat, particularly some vegetables. We brought in an owner of a vegan food truck from Tuscaloosa to York. And he talked to them about different spices. He talked to them. We weren't able to put together an actual cooking class, but we did bring someone with the food truck who could teach them how to eat healthy.
So when you leave and it closes, it's locked.
Thank you so
The
much.
students don't hide here.
Thank you. So they don't hide here. Thank you for everything.
And I'm sorry. And then they also got to sample vegan burgers and vegan cookies, which I think was really exciting, that the kids were really excited about it and surprised that it didn't taste nasty, right? So they were really happy about that experience. Next slide, please. So we are, because we were just developing our youth councils and our programming. We're in the process now of evaluating the programming and trying to get a sense of what we need to change, what we need to improve, but also looking for additional funding so that we can continue the programming that we have after the grant ends. The communities, again, are super energized. They have really learned a lot from the community events where we have conversations about different chronic illnesses. We spent a lot of time talking about mental health and the need to exercise, because there's definitely a lot of chronic stress in these communities. And some of them have developed sort of dancing programs for the older adults, and walking groups. So Fort Deposit has a walking group. And we are trying to develop new programming and grant writing to help fund some of the work that we're trying to do. I also want to shout out Jamarian, who was just on the front page of the local newspaper today. He got a scholarship. He's a senior, and he got a scholarship. And one of our other youth council members got a scholarship to attend our HBCU partner institution, Stillman College. So we're hopeful that we're empowering our youth. We think that we are, to create change in their communities. They definitely understand their communities better than they did before we started this program. They understand the needs of their community, and hopefully they will be the people who will make changes in those communities. Next slide, please. So I would like to first acknowledge the mayors of these 5 communities, because they have done a lot of work to make this happen, and the staff, the youth council directors and the youth council members, and especially the residents in those 5 amazing communities. I also want to thank the Office of Minority Health for providing the funding to support the work that we've done in these communities. Thank you.
Thank you so much, Dr. Newman and Jamarian, for sharing your insightful stories and presentation. And wow, congratulations, Jamarian, for securing the scholarship. I'll now turn it over to our final speaker, Dr. Jason Rosenfeld and Leonard Trevino. Thank you.
Thank you, and I'll start. Good afternoon. My name is Len Trevino. I'm the program manager with the health department in San Antonio, home of the Spurs, home of the Alamo, and home of weather that sometimes requires you to have your heater and your air conditioning on the same day. So good afternoon. For the past 3 years, I've overseen a team that came together as a result of the COVID-19 pandemic. This team has been directly responsible for the success of the COVID-19 Community Response and Equity Coalition. You may hear it referred to as the CREC sometimes. The CREC came together early in the pandemic. Community partners, individuals, healthcare providers, and non-traditional community organizations joined forces to create a unique and formidable response. The CREC has reached a membership of over 300 individuals. It included public health leaders in the community, faith-based organizations, community health workers, individuals, and so many more. The CREC did most of its work at the subcommittee or work group level. Some of the work groups were policy and advocacy, education and enforcement, indicator monitoring, and contract tracing. To date, the CREC is still in existence. It's re-examining its future and how it will get what we learned and apply it to other public health priorities in the community. When we received the Health and Human Services notification of funding opportunity for the Advancing Health Literacy, we immediately turned to 2 of those partners, especially UT Health and University of Texas in San Antonio. We, the three of us, Metro Health, UT Health, and UTSA, felt that this grant opportunity was great for our community and our institutional partnership. We took a different approach to pursue this opportunity. We created this three-way partnership. The partnership consisted of the health department, San Antonio Metropolitan Health District, as the lead, the grantee, or the project administrator. UT Health as the implementation arm of the project, and you're going to hear a lot of great things in a few minutes. And University of Texas at San Antonio as the evaluation component of the project. Now, I do want to mention that this was the first time that the health department had taken this kind of approach to this partnership. We've learned a lot, but it's been very successful. So what I want to do now is turn it over to Dr. Jason Rosenfeld with UT Health for all those great details.
Great. Thank you, Lynn. And thank you to the National Academies, to the Office of Minority Health for organizing this webinar. I'm honored to be presenting on behalf of a wide partnership network about our work under Health Confianza. And before I move on, I want to just take one moment to define this term, Health Confianza, which was a name that we came up with intentionally. For those of you that speak Spanish, you'll know the dual meaning of confianza, both trust as well as confidence. And that was our underlying goal for the AHL project, using health literacy principles to address health equity to both improve and enhance trust between our communities and our health and social service systems, but also to build people's confidence to make the best decisions for themselves. And so what I want to talk to you about today are some of our youth ambassador and community health worker strategies. Next slide, please. And so I just want to again acknowledge the Office of Minority Health and the Department of Health and Human Services for funding this two-year program. Next slide. So when we designed our AHL grant, we intentionally designed it at a multi-level model using the socio-ecological framework here that you can see. I'm sure many of you are familiar with this. And we intervened at the individual level, the interpersonal level, and the organizational level, with the understanding that if we only were to intervene to improve people's health literacy, then we continue to put the onus on our already marginalized populations to change, and avoiding the necessary change that needs to happen at our organizational levels and the level of our healthcare providers who need to meet our community halfway, or even farther than halfway for that matter, to improve health outcomes. And so we designed our strategies at these multiple levels, again, with the goal of helping our community make the best decisions for themselves. Next slide, please. I just wanted to show you the scope and scale of our ambitious program that we've been implementing for the past 2 years. So you can see we've had interventions at the individual and community level, reaching just over 7,500 people over 2 years. At an institutional level, working with healthcare providers, community health workers, and other social service actors to improve health literacy principles and programs. We've reached just over 1,600 folks. And then at the organizational level, we designed and piloted the first of its kind pledge program to bring 10 organizations together to engage in a learning community to help them become more health literate organizations to better serve their populations. And if you click next, what I'd like to do is just focus in on these 4 components of our ambassador programs that we're really here to talk about today. So next slide. One of the earliest strategies that we deployed in collaboration with the San Antonio Independent School District back in the fall of 2021 was to design and deploy the sequential engagement strategy to enhance our community's access to and interest in getting COVID-19 vaccines at the time. And so what we first did was we engaged with the school principals, who then helped us identify youth leaders on 3 high school campuses in San Antonio. We then trained trained 92 ambassadors over a 2 to 3 session series to equip them with both the knowledge about COVID-19 as well as vaccines, but also the skills to communicate with their peers, their family, their neighbors to encourage them to get vaccinated. We then hosted a community town hall, which is the picture you can see on the upper right-hand corner, to answer people's questions, to demystify the mRNA vaccines, but also to bring our youth ambassadors to the conversation so that they could advocate on their own behalf about the value of vaccination and preventive health. That same evening and into the next day, we would then, working with partners, including University of Incarnate Word, Lila Pharmacy, the Health Collaborative, we would offer a vaccine clinic where we had COVID-19 vaccines as well as childhood vaccines and the flu vaccines. What was really exciting is that our community conversations, we had over 247 participants attend robust conversations, and the data that we collected from the vaccine clinics was over 291 vaccines were provided across those clinics, which was, and then we had about 86 vaccinations per town hall, which was much higher than the 15.7 on average that our partners were receiving at just general pop-up clinics. So this proved to us that there was a good model of engaging with natural leaders, in particular our youth. Next slide. So we continued this progress and we began engaging with more youth across the school districts. We provided 18 sessions reaching 113 students, including here, pictured here, some youth from a middle school at the local school where actually my children go to school. But we also provided community ambassador trainings, training community health workers, faith leaders, other natural leaders with the knowledge about COVID-19 and the skills to be able to then communicate in plain language about the value of preventive health programs. And so if you go to the next slide, the core competencies that we're really focusing on, leaning deeply into the health literacy principles that my team had expertise in, were these 6 skills. So first, setting the tone. How do you open the conversation so that people are willing to talk to you about their opinions on COVID and COVID-19 vaccines? What is active listening, and how do you actually do it in a way so that we are not just waiting for our opportunity to talk, but we listen and then respond to the items that somebody is sharing with us? Using plain language to talk about mRNA vaccines. This was a core part of what we did in our trainings, is how do we talk about what mRNA is and how vaccines operate so that people can understand it and see that there's value into not just waiting to get sick with COVID, but ideally getting the vaccine first to boost immunity. A key piece that we learned early on is training people to acknowledge perspectives. You don't have to agree, but you do have to acknowledge people's perspectives so you don't just shut down the conversation immediately. And then how do you bridge from somebody's own perception of fact or a misinformation to a factual piece that you would like them to know? And then finally using teach back to ensure understanding, but putting it on the onus of you as the educator, the natural leader, to say, how did I do? What did you understand of what I said, so that ideally you can move forward with confidence? Next slide. So when we moved on from our ambassadors, we then had a deep dive strategy called community health clubs. And this is a peer-to-peer model of participatory education that brings groups together for learning over a period of months and sometimes years. The core component of the community health club model is creation of a social identity. And so there's a couple of clubs that you can see here in this picture. Fuerza Unida is a local nonprofit organization where our lead community health worker, Joaquin Abrego, formed the club. In the big picture, you can see working with YWCA. This was a group of young women who were being trained to become community health workers to serve their community on the West Side. They created a club called Bagels. They met weekly for a number of months and went through our COVID-19 curriculum that I'm going to show you in just a moment. We also created a club with one of the high schools that we started the ambassador program with, and their club name that they came up with is one of my favorites. It's called the Community Health and Mental Organization for Youth. And that then comes into the acronym chamoy. And for those of you that have been in South Texas before, you know that chamoy is that delicious sauce that you put on top of your fruit. And so this was the focus of what they wanted to do as youth. And our job was to respond to them, empower them with knowledge, listen to their issues, and connect them to resources. And Ilana, if you could just click on the soundbite there, I want to share with you one of the club songs that Joaquin helped create with the Fuerza Unida Club here, which is part of how we disseminate information through clubs. Are we going to be able to share that sound? If not, it's okay. We can move on. It's okay. We'll move on.
It was playing on my end. Sorry, maybe because I was muted. So I'll unmute and try again.
Okay.
Hello, anyway, you're asleep. Is this corona or is this just allergy? Caught in an outbreak, no escape from reality. Cover your mouth so you don't spread it to me. I'm just a poor boy. I need a free vaccine. I felt the fever come, fever go, little high, little low. Anyway, your sneeze blows. Stay 6 feet away from me,
Thank you for that. And hopefully Joaquin does not kill me for airing that on a national presentation. But again, it goes to show how working with youth and working with natural leaders, we can contextualize information in an innovative way, share it in a song that is slightly humorous, but then will also help to break down barriers to communication. So next slide. In addition to having songs, creating a social identity, and having fun, we generated a 10-session community health club curriculum focused on both COVID-19 as well as core health literacy principles. What is a scientific process? How do we identify fact from fiction? How do we identify scientifically accurate information online, all using participatory games, fun, singing songs, having dramas, etc. And that's a resource that we would love to be able to make available to anybody who may be interested in seeing more about that. If you go on to the next slide, a couple of quick lessons learned. What we learned, and I think we've heard it from all of our presenters today, we have to first seek to understand. So go to community, go and listen to our youth because they know what is important to them and they know how to talk to their peers. And so that's why we worked with our natural leaders. And we really learned that we also needed to spend more time on building skills. We focused a little bit too heavy early on information sharing rather than on skill building, particularly around communications and generating culturally and linguistically appropriate messages. So we wanted to expand our follow-up and support. Oftentimes we found that we were providing the training to our youth and to our community health workers, but we weren't able to establish the long-term follow-up to see how effective the training was and what they've done with the training. We've also been working on creating pathways from ambassador trainings, the 5-session training, to the longer-term club so that we can reach more people in a shorter period of time. And then finally, have fun. And I think we've heard this from everybody. If we're not having fun while we're doing public health, then nobody wants to talk about public health. And the youth will always bring their energy, their memes, and their creativity to this. Final slide, next steps. We've established a memorandum of understanding with San Antonio Independent School District, where over the next couple of years, we're going to try to work to reach their 45,000 students and family with ambassador trainings and clubs. We'll be hosting a Health Equity and Action Summit, was our culminating project for the AHL Award on June 9th. And then finally, as a complementary grant to this, we were fortunate, and I'm the PI of a community health worker training program grant grant, where we're going to be looking to create pathways for our high school students who have worked with us as ambassadors or not to begin getting trained as community health workers, so that they can see that there are other alternative pathways to serving their community, working in the health field that may be different from the clinical practice that they've always maybe been exposed to. Next slide. If you'd like to learn a little bit more information about us, here's where you can find information. You can follow us on Instagram, Facebook, and Twitter. If you're interested and you're in the region, come join us on June 9th for our Health Equity Summit. And with that, I'd say next slide. And thank you very much for your attention. And I look forward to having a robust conversation with you today.
Thank you, Jason, for closing out these just amazing presentations. Now I'm happy to present to you the moderators for the panel discussion and the Q&A session. Dr. Jill Abel and Dr. Olayinka Shimbayola are both members of the planning committee for this roundtable and members of the roundtable. Dr. Abel is Executive Director, Patient Caregiver and Consumer Experience at Merck. Her team seeks to improve and optimize the experience of patients, caregivers, and consumers, and to capture and embed patient insights and perspectives across the product lifecycle. Dr. Shiambola is Associate Professor in the Division of Social and Administrative Sciences at the University of Wisconsin-Madison School of Pharmacy and Associate Director at the University of Wisconsin Collaborative Center for Health Equity. Her research program advances the use of patient-centered approaches to improve diabetes and related chronic disease outcomes in marginalized populations, medication use, health literacy, and health equity. Turn it over to you, Jill.
Great. Thank you, Rose. And thank you to all of our presenters. This work has been really terrific and it's incredibly inspiring. With that, though, I'm delighted to bring back all of our speakers together to engage in a discussion about their work. We're hoping to explore some of the themes discussed today, such as the youth ambassadors' education and training, and strategies to sustain the program after grants might end. So to our audience, please continue to share any questions you may have via the Q&A function at the bottom of your Zoom window. And to get us started, we do have a few questions specifically for the youth ambassadors that we've been privileged to hear from today. We'd love to hear a bit more about your experiences and motivation to participate. So to each of the students, you have all made a decision to join this program and to take on some really interesting and challenging projects. And I really want to say congratulations to all of you for that incredible work. But I'd like to ask each of you, as you look back on your journey, what has surprised you most in your role or your training or the work that you're doing? And I'm happy for any of the students to jump in.
Yeah, good afternoon. This is Erica Logan-Gales with the Fairfax County Health Department. I was with our young ambassadors, and unfortunately, they all have after-school activities.
Oh, no. Okay. No problem.
I think my student Jamarian is still in school because we're on Central Time, so he's gone.
No worries then we can shift over to all of our PIs. And the first question I'd like to start with this group is, while the grants are funding the initial programs here, how will the individual grants, how will you be able to sustain these efforts moving forward?
Right, I'll start. So we have two kind of models for sustainability. So one model, as you see, we developed a curriculum. So we actually sell that curriculum and we funnel the purchases back into the program. So we're able to train more students. So that's one way we approach sustainability. Another way is that as we're training our young people, we are looking for, employment for them. Many of them are going on to college and the military, but we're also also looking for employment. And so I was fortunate enough to have another HRSA grant we deployed 100 outreach workers, and I was able to actually employ some of the high school community health workers because they had been over 18 and they had graduated and they needed a job. And so they actually already had the training. They did some additional training and were able to be deployed during the pandemic. So, those are two ways to think about sustainability.
Right.
And as far as the Fairfax County Health Department, if I could build upon Aletha, we've standardized on their curriculum set. We have a great partnership with Morehouse School of Medicine. But in terms of sustaining the work, we actually have strategically brought that program internal to the Fairfax County Health Department. We've hired staff. We will be hiring additional staff. Therefore, we have a commitment to continue this program in our partnership with Fairfax County Public Schools and the other practicum partners. We see this as a long-term process to change trajectories directly in our communities of color in Fairfax. So we're making those investments to do that. Additionally, we are creating pathways and partnerships internal to our organization alongside some of our divisions. I have the privilege to be the division director for community health development, but we have a school health division within the health department, and there's conversations going on in terms of mentorship between school health and our youth ambassadors. And then we're looking for pathways in terms of employment and connecting our students locally to like George, one of our partners on our Stronger Squared grant, AHL grant, is George Mason University College of Public Health, and helping support those students that want to track to that university, making connections, writing letters of recommendations to sustain their own personally chosen paths as well. So part of our sustainability model is not just continuing the work internally, but also continuing to support and sustain that support with the students that have already graduated with our program. Again, I said earlier, what we're trying to do is to change long-term impacts in community, utilizing those students after they've attained the goals of their choosing, with the hopes that they'll come back to their community and feed that wealth of knowledge that they've gained on the outside back in their communities.
In San Antonio, since the health department, the city of San Antonio is the official grantee, we're working very closely with Jason Rosenfeld, Dr. Rosenfeld, UT Health, to clear the way and make sure that legally all the intellectual property is turned over, because they've already begun plans and discussions for continued some of the strategies. So, Jason, I don't know if you want to kind of mention what your thoughts are.
Yeah, what I was going to say is, the money is always a challenge, right? And we're always looking for new opportunities to collaborate with different donors, and there's some interest already there. The part I wanted to talk about was similar to what Anthony was sharing. We've now got the agreement with the San Antonio Independent School District. We have agreements pending with other school districts in San Antonio. We're one of those unique cities where there's 7 independent school districts. So there's a lot of ground to cover there. And part of our model has always been train the trainer. So the idea is that we're not out there having to do the work, but we're going to train school nurses, we're going to train social workers, teachers, parent liaisons to help lead the ambassadors, help form the clubs so that those get sustained. And then we become a backup resource and mentorship. And then from day one with our ambassador piece, we've gone with working with CHWs who are already employed or natural leaders who have an inclination for this work, so that there's not money tied to the delivery of a program. It's just simply, we're going to give you skills and technical information. And Health Confianza wants to continue to be a resource hub for all of these organizations and individuals, so that as they go forward, we pivot from COVID-19 to mental wellness to chronic illnesses to whatever the issues are of priority to the community.
So Fort Deposit is very different than the other three. We are rural, and so some of the resources that you guys have, we do not have in our communities. So when I say rural, you saw the population size. These towns do not have the resources, and so it's more of a struggle, I think, there. So we're of course looking for other opportunities for funding. We have also created some of the members of the community who are very engaged, created some 501(c)(3)s so we can also do some fundraising to help maintain some of the youth activity that we've already started. So we're at a completely different stage and circumstance than the others. And I think being in these rural communities makes it a little more difficult to think about how to sustain these activities without the support of that you have in larger communities.
Great. Thank you.
I think that's important for me to say, that put more money in some of these rural communities. That would be very helpful.
Yeah, I should also mention that I agree with you. Definitely put more money in the rural communities, but also would say we did a pilot. We do pilots in rural Georgia, and we just partner with the schools. So we bring the resources, with us that we have, partner with the schools, and we have a couple of programs at Morehouse School of Medicine that's the focus, to partner with rural communities to train young people as community health workers. So I think both, and so thank you.
Thank you.
Well, thank you so much for all those answers to that questions about sustainability. It's definitely a hot topic when we think about community healthcare workers. One of the questions that I have for you is there are so many organizations, as you know, that are on this platform, and some of them are going to they're all hearing about this today, and they've decided we want to create a similar program. What are some of the things you think they should know as they prepare for this? So, for example, thinking about whether organizational policies that were already in place that would be willing to work with the youth. I think there was a question from the audience about employer, industry partners. Did you have to do youth development, background checks, just a lot of all the processes that needed to be in place before you got started?
I'll go ahead and start the first one to that, because it was one of those long lessons that I think everyone has probably learned, right? So we were fortunate during the initial phase of our implementation, when I described that sequential engagement strategy, that the process for engaging with SAI, the San Antonio Independent School District, was a little bit easier because we were still in an emergency and people were trying to really promote vaccinations and get the word out there. Subsequently, the intervening year and a half, it was next to impossible for our team to get back into the campuses and continue the conversation. And one, because it was the priority of educating their students. Get it, right? I don't want to be a distraction. And so it wasn't until we were able to go through the front door, the very formal process of speaking to the school board, getting approval from what do they call, the School Health Advisory Committee, the SHAC, and then making sure that we were establishing the very formal MOU for us to move forward. So my advice is start well in advance of when you plan to do it, because working with school districts, as I'm sure everyone on this call can share, takes time. There's processes to jump through, and there are good processes, and they're the appropriate ones. But you just have to bake that into the planning.
And I couldn't agree more with Jason. Jason, thank you for bringing that up. I agree wholeheartedly. I would add there's some other strategies as well. If you think from a perspective that who has their hands on that youth population, it's more than just the public schools. It is community-based organizations. It is faith-based organizations. There are student clubs and athletic activities. So we try to reach our students through multiple avenues, as well as even community colleges or private school institutions, just trying to get the word out. We have a large social media kind of presence and activity as well. But I think the main takeaway is that I agree with Jason wholeheartedly, because the linchpin in that process is absolutely the public schools. And as I said in my presentation, I believe wholeheartedly, particularly in when working with students of color, that it is, for the reasons I gave earlier, it's really important that they can receive these types of interventions during the school day, because many of them absolutely have to work, because many of them help to support the household that they come from. And I think that's a point that we cannot miss, because that's the same story, whether it's a rural county or it is an urban county. Thank you.
So there's been a couple questions coming through the chat regarding, have you been able to form any partnerships, or are there any partnerships you might envision, such as with local hospitals, local clinics, industry partners, local businesses, to help, engage with the students? I mean, I saw some of the great projects that were highlighted from the ambassadors in the presentation, but can you share any thoughts on what those partnerships are or could look like?
If it's okay with everyone, I'd just like to start. So from our perspective, we really centered our focus on partnerships around practicums, the practicum requirements of the curriculum, knowing that those relationships would allow our students as well as to build networks within those required practicum or field hours that they're experiencing. So we've partners like here locally, our Inova Health System. Our FQHCs, we're partnered with 2 FQHCs, and also, private healthcare providers and other clinics, our George Mason University College of Public Health. So we really centered the practicum experience. Oh, and I'm sorry, George Mason University's MAP clinic, as you saw previously. But we centered our partnership there first, knowing that we would be able to, once established, be able to grow that partnership.
Excellent. Thank you. Other thoughts from the others?
I can quickly share again. I mean, when as Lynn mentioned in his introductory comments, during the pandemic response, the city of San Antonio really came together in a collaborative nature. We had the coalition that was formed, and that was really the genesis of the success I think we've achieved under this AHL grant, because we have a network of over 40 partners with whom we're working. Some work with youth, others work with adults and in community centers. But what we've been striving to do at the university in particular is marry some of the work that we had already been doing with health professions training. So we have a very robust community service learning program that my colleague Melanie Stone directs, and we've tried to leverage those existing relationships to bring both our students into the field, but also to marry those students with youth that are trying to understand what their future may look like. So I mentioned the Lanier High School, the Chamoy Club. We would bring our medical students out to meet with our high school students so that they could see, oh, that's what a medical student looks like and sounds like. And it demystifies the entire process. And then through that, we are trying to build relationships with FQHCs, with other social service agencies. We have a robust partnership with Metro Health, and presenting the options to young people so they can see that there's not just physicians or nurses, but there's a whole realm of healthcare workforce that they may be able to jump into.
And I'll just add also just really quickly that I mentioned that we have a HRSA grant to work on a registered apprenticeship program. So we're in the process of training and deploying 120 community health workers. and upskilling at least 20 additional community health workers. And so we have a Department of Labor approved apprenticeship program. And I think that's a really next good step because it's helping people get employment, on the job training, as CHWs. And we're working with many of our community partners, Georgia Department of Public Health, the partners that we've been working with all along, the FQHCs and so forth, in order to have places for the people who are a part of the apprenticeship program to be placed and to have that experience. And so when I think about our youth and young adults, I think this is a great step because we are developing this pipeline, of education, starting with the high school and then the young adults and then on to an apprenticeship program and full-time employment. So I think that those pathways are extremely important.
Yeah, and I think a lot of it is what's already been said. I think for us is we now partner with Stillman College, but more partnerships with some of the HBCUs in our area, I think is what would be real, so that our students can see other students who aren't that much older than them and see what the possibilities are. I think that has been really good, I think, for some of our youth council to work with the Stillman College students. So that's one. We, again, for us, it's really about trying to get additional funding to do some things. And so we have applied for funding to support some of our students to attend some of the community colleges around to get some training while they're still in high school, right? So that they can be prepared for college, because we also have to be sort of clear about how well some of our K through 12 is preparing our students for college, and they need that additional training for that, or just to go into the workforce so that when they graduate from high school, they can maybe also have an associate's degree and be ready to go to work. And so those are the kinds of things that we've been thinking about and trying to partner with some of the local community colleges to try to support.
Okay, so we'll take one last question from the audience. Somebody from the audience is asking, can you speak more about how do you evaluate your programs and what to you is success? What are your measures of success?
I guess I can say, I don't know. That's a hard question, right? So, because what we want to see is these 5 communities being healthier and the students being more engaged and changing their community and making their community better. But what we end up doing is some surveys or some focus groups, because we don't have that long time sort of scale to be able to see in 10 years or 5 years, what does it look. So it's a bit difficult, but I think right now it's based on what the youth council members sort of say. If they say that they're getting something out of it and they're actually implementing some of the things that we're teaching them, then that's a success, I think, for us right now.
Yeah, and from the Fairfax County Health Department perspective, on our grant, we have a robust qualitative and quantitative evaluation team that's led by George Mason University School of Public Health, and also Virginia State University, who is handling, it was actually the evaluation lead on the project. So we definitely have a robust evaluation. As far as how we're measuring success specifically in our public health, that's an overarching for the entire project. But specifically for our students in the public health program, there are pre and post tests at every module that our students are taking. And we're certainly tracking that organizationally, internally. We're building supports around, re-engaging our students in the areas perhaps that might need further support. We're utilizing that data as well as how we're strengthening our strategic planning going forward with the program. Things like, having, and I just had a call yesterday, but wanting to have like strategy calls with our partner at Morehouse College of Medicine, so we can give feedback on the experiences that our students are having with the curriculum itself, but also their experiences in the field. The student in our program, we're trying to elevate the student voice, which we believe wholeheartedly represents community voice. That they are just as strong of a component of voice in community as any other demographic in community.
And I'll go ahead. Sorry, Arlita.
Oh, no, I was just going to say, in the interest of time, I just put two links to information about two of our publications that detail the programs and the evaluation metrics and kind of what we went through. You know.
Thank you.
I was just going to quickly reiterate, it's challenging, right? I mean, because we're tackling big issues, and I think we're still collectively trying to determine what does a health equity outcome look like. I did want to just say that we have our colleagues at UTSA that are also robustly evaluating our program, and we're all looking forward to seeing what comes out of those that evaluation. The one piece I wanted to add was that part of what we are looking at intentionally is trust. We are looking at trust measures between community and the social service and health service system, but also within community. I think we don't talk enough about community building and the social support and the social capital measures that should exist within communities to help them become as successful as possible. So we're trying to look at some of those measures and how ambassadors can help build that within their own community.
Thank you all. Given the time, unfortunately, we will need to close our discussion. So thank you to all of the panelists here for taking their time to share your work with us today. I'm going to hand it over to Dr. Shion Bowler for some closing comments.
Well, first of all, I want to thank you all, our panelists, for all coming today and presenting and sharing your insightful work. I also want to thank everyone who attended today's workshop. And thank you to all thank you to Jill as well, that's co-moderated with me, and also our ASL translators for their invaluable contributions. And so within the next week, you will be able to find the recording of this webinar on the event page. We really hope that you found this session informative and that you also gained some valuable insights that you can apply to your professional work, take to your organizations, and also within your communities. So please stay tuned. There's going to be more upcoming workshops that will be organized by the Roundtable. And if you would like to receive notifications about our future events, please sign up for our listserv. So again, thank you for attending and have a great week.